Welcome back to another episode of the Association Spotlight Series. I'm Lake Morehouse, and today we are joined by a familiar face, our old CEO here at the Association, Mark Drennan. Mark, thanks for coming on in your new role, and it's interesting to see you on this side of the fence, and appreciate you coming on and giving us your time today.
Well, thanks for having me back on, even though I'm not here at the association anymore.
And we can kind of get into that a little bit. You aren't, but you're still nearby, which is good. And,
right.
Still working in the kind of the same arena here in West Virginia and helping out. So if you can just kind of tell the folks a little bit what you did here at the association, most of them know, and kind of what you're up to now.
Well, I came to the association back in August of 2011, and so I spent 13 years plus here at the association as the executive director, and it was a lot of fun, and I think we accomplished a lot of things. We grew the association, and made some changes in the legislature, and created a presence, I think, for the association and its membership. So. We shed a spotlight on some of the issues around mental health issues and substance abuse, IDD population, and children's issues around the state. It's funny, when I first came here, we were at the beginning of this, opioid crisis, and so there was a lot of demand for treatment services for people. And so you got to see that from the beginning, to where we are now, which, if you want to get treatment for your addictions in West Virginia, now you can do that.
Right.
And, and you can get it if you want it. And back in 2011, that wasn't necessarily the case.
Right.
Maybe if you were a female or you're a pregnant female, then maybe you could have gotten treatment, but really struggled for males to do that. And so you got to see some growth there. And building an image, I think, for the Behavioral Health Association has been helpful. We were active here in West Virginia and nationally, and so we built relationships with people all across the country. And I guess once you've done something for a long time, it's time to think about doing something different. And I came to the association from the child welfare side of behavioral health, and I worked for a lot of years for a provider of children's services and ran children's emergency shelters, and I even had a short stint doing child protective services in my youth. And so an opportunity came open for me to go work with the National Youth Advocate Program.
Okay.
And it's what I knew it as, growing up in this system was a foster care agency, and certainly. Today in West Virginia, we're still a foster care agency and been active since the early 80s in West Virginia.
Okay.
Today we've probably got about 250 children being served in foster care across West Virginia.
Okay.
And we have a number of other programs as well, where we work with children who are are engaged with the court systems due to some sort of delinquency. Or incorrigibility, and so we provide services to those kids, try to get them to make amends for their crimes if there are, to work with the people who they have been convicted of offending, whether it's through whatever types of crimes. They try to make amends for that and reintegrate them into their school and their community so that they can end up growing up and being productive members of society and not take that path towards jails or prisons or, unfortunately, death, which happens a lot of times with kids that are in that situation. So we also have programs to work with families who are engaged with the Child Protective Service System.
Okay.
To try to maintain those families together in their homes. Try to prevent children from being removed and separated from biological families, and I think that's one of the reasons that I switched from, this side back to the provider side, is to try to make an impact there.
Sure.
I've seen for so long and been, involved in this system that I think first seeks to, keep families together, but quickly, I think, and maybe sometimes too quickly, tends to separate families. And I'd like to, to be part of a system that tries to keep families together.
Yeah.
And I've recently wrote an opinion editorial, and it talks about how my mother was an orphan, and I've told you this before probably, and she was 8 years old when her parents died within 6 months of each other. One due to heart disease and the other due to cancer, just kind of independently, and it was really a tough time.
Wow.
It was the 1950s, and so it left her and her 3 brothers and 3 sisters to kind of fend for themselves.
Wow.
And so she was raised by her 2 sisters who were 21 and 17, and unfortunately, they've all since passed on. My aunt, who was 17, that raised the whole family, was the last one to pass away. She passed away earlier this year, and she was a champion to keep those kids together.
Right.
And one of the things that in talking with her over the years, she always questioned whether it was the right thing to do, or whether it would have been better to split them up and send them into the foster care system or not. But what I've noticed with them, and that was certainly, we talk about in this industry how trauma affects people in their lives, and certainly they were subjected to trauma at that age.
Yeah.
They were thrust into poverty because they didn't have parents that were providing for them, and then so they were being provided for by their 2 older sisters who were barely adults themselves.
Right.
Yeah. And so, but what my aunt did was, she said, "You're all going to graduate from high school, and this family's, which had to rely on assistance from the state for a period of time, is not going to do that for the rest of our lives. We're going to get off of this system, and we're going to be productive members of society." So, my mom and the 2 sisters went to college, and my aunt, who was 17, became a chemist even at that. So she, worked for the chemical industry, became a chemist. My one aunt became a school principal, had multiple master's degrees, and then my mom ended up going to Bible college and got into Christian education, and did stuff around music, which was her passion. And then all the boys, the 3 boys, they went into working for the post office, into manufacturing and those sort of things that were pretty commonplace, and so they were raised their own families. And one of the things that I've noticed in that is, when we're talking about trauma, is that they didn't, while they had trauma, and it definitely had an effect on who they were, they didn't pass that trauma down to the next generation.
Sure.
And I think what we have in our system now is where the system doesn't help us break that cycle of trauma.
Sure. Kind of seal it off.
Right.
Yep.
Seal it off. We pass it to the next, and
Yep.
then to the next. And so one of the things that it's been nice, and I've been allowed to do at NIAP, the National Youth Advocate Program, is to seek opportunities to work with the system to create and build programs to help keep families together.
Right. So that's kind of that's the big takeaway there from that, and that's the idea and the strategy you're aiming for.
That's my strategy.
Yeah.
We'll see if it works out.
Sure. I mean, it's everyone does know, it's child services and in West Virginia have been at the forefront of a lot of media lately, and there's been some obviously very devastating things that have happened, and it's certainly a crisis. So it's going to take all of us, and it's going to take new creative ideas, outside the box thinking, and I don't think there's a wrong way.
Right.
There may be, but I mean, it's just to kind of attack this at a different maybe a bit of a different lens. So that would kind of bring me to my next question. Just so you being a former CEO here at our association, now being a member, NIAP is now a member of the association, and you being on the provider side, what what has been your biggest kind of takeaway and differences and some contrasts that you've noticed while here at the association? You oversee all of behavioral health, and we see all of our different industries and whether it be children's services, mental health, IDD, things like that. It's kind of a 30,000-foot view of the whole industry. Rather now you have a more narrow, zoomed-in view of just on children's services. And do you feel like maybe you can kind of get your hands dirty now, kind of really dig in and kind of get really into this? It's more specialized. So.
Yeah, I think you're right. I mean, I think at the association we see a broad swath at this 30,000-foot level, and I think we're so removed from the weeds that it allows us maybe a little bit clearer of a picture of the system as a whole.
Sure.
I think one of the things that I've noticed is when you get into being a provider, and it gives me a little better perspective from what I've been doing, for the last 13 years. And maybe I could have done that a little better,
sure,
or communicated that a little differently. Is that they're focused on as a provider, you're focused on exactly what's going on at that moment. You're trying to impact the life of a family or a child or an adult, right then, and you're not seeing the larger things that are at play. Like at the association, we're working on public policy, and we're advocating for bills that can become new laws. We're considering the national implications from the federal government and the courts, and so there are so many things that are at play at this level that once you get down to the provider level, you just care about making a difference in that individual's life right then and right there.
Yep.
And sometimes I think at the provider level, you think there's a lot of hurdles that shouldn't be there.
You're starting to learn that, see those now, right?
Yeah, now you see that, and
sure.
And so, hopefully, that brings me a different type of perspective. And one of the things that I've been allowed to do here is to stay out of the weeds. And one of the things the leadership at the National Youth Advocate Program at the headquarters is they don't want me doing that. They want me to still stay high level, but high level for them, and try to direct and where programming goes from a 10,000-foot level versus a 30,000-foot level, but not being right there on the ground. So
good balance.
It's a good balance of those.
Yeah, well, that's great. We can kind of end it on a positive note, if we will, with obviously all the struggles and the you see a lot of the bad parts of the crisis that is happening, not only in West Virginia in child care, but in foster care, but throughout the whole country as well. What are maybe some positive things you're looking forward to, specifically here in West Virginia, to kind of help this crisis? Some exciting maybe developments on the horizon, or just some ideas or strategies you were hoping to kind of bring to the state and NIAP.
Well, there's a lot of things that we're working on that I think are pretty exciting.
Good, yeah.
But if we want to end on a positive note, I'll just say that, last month I was at our office down in Winfield, and there's a young man there, a teenager, who had been involved with the court system, and he was, graduating from the drug court, the juvenile drug court, and he had been working with our staff in that Winfield office that helped him to try to get back on the straight and narrow, graduate from high school, and move beyond some of those those things that he was engaged in before. So I think that you make those differences one at a time, and cumulatively they'll make a big difference in the lives of the children and families that we're engaged with in the system, and inevitably will be better for all West Virginians.
Yeah, absolutely. Just seeing that, probably, even though it's one case and one person, I think it's see that come to fruition has got to be encouraging and kind of makes you have some confidence in that, and just stack small wins, right?
Well, we know people can change, and that's why we're here. We wouldn't be in this business if it wasn't possible, and it is possible. We see it every day. We just have to keep plugging away.
Absolutely. Well, Mark, thanks so much. It's great to have you on this side as a member now of the association, and we appreciate your time, and obviously looking really forward to everything that NIAP will do with the association, and we'll stay tuned. So,
all right. Thanks a lot. Thanks for having me.
All right.